Welcome back to our ongoing series on cyclic vomiting syndrome with Dr. V. I'm Steve Wartenberg, and this is Dr. Thangam Venkatesan. In past episodes, Dr. V has filled us in on the prevalence and impact of CVS and how it is diagnosed and sometimes misdiagnosed. Today, Dr. V will talk about treating CVS, and she'll do it in two parts. In this episode, we'll look at what's called prophylactic treatment, which is the treatment and procedures that can reduce and prevent episodes. In the next episode, Dr. V will discuss abortive treatment, which is treating a CVS episode once it's begun. You led the team that created the guidelines for preventing episodes, so fill us in on how you did that, and then we'll go through the different steps that people can utilize to prevent an episode.
There was significant variation in how different physicians were treating patients with cyclic vomiting syndrome. And really to, close that gap, I spearheaded the effort, and we collaborated with the ANMS, that's the American Neurogastroenterology Motility Society, and also the Cyclic Vomiting Syndrome Association. And so we actually published the first ever guidelines on the management of CVS in adults in 2019. This is what we call an open access article. So really anybody in the world can really go to your computer and you can print it out, and you should be able to know how to manage CVS.
So what is in the guidelines? Start with, I'm not even sure, but there must be a step one.
So when we really review all of the prophylactic medications in cyclic vomiting syndrome, we have certain classes of medications. And the first class, and really the one that has the most amount of data, is amitriptyline. It's a neuromodulator. It's also a tricyclic antidepressant.
So when you say neuromodulator, what does that mean?
So it really modulates the way your brain sort of talks to your gut, and so there are various signals that go from your brain to the gut, and CVS is what we call a DGBI. So it's a disorder of gut-brain interaction, and what the neuromodulator is doing is it's that modulating the connection. And so by doing that, we can prevent CVS episodes.
Well, okay. And what's the next sort of area of medicines?
We do have another medication called topiramate that is also used in the prevention of cyclic vomiting syndrome. So it's sort of like a second line agent. There is a newer medication, it's called aprepitant, and it is an NK1 receptor antagonist. And aprepitant was actually developed it is an antiemetic, and I want to make this very clear. It's not a cancer drug, but it is FDA approved to prevent chemotherapy-induced nausea and vomiting. So it's actually approved for chemotherapy-induced nausea and vomiting. It is not a cancer drug.
Right.
And
it's for a side effect of a cancer drug.
It's to treat a side effect of a cancer drug.
Chemotherapy.
Exactly.
And it can have some impact on CVS.
It does. And so while there are not what we call randomized prospective trials, we do have some studies, and I myself did a study, and so it was actually very helpful in preventing CVS episodes in almost 70% of patients who actually didn't respond to other medicines. And so we looked at our data, and we found that it was quite effective. The other nice thing is it really is very well tolerated in patients. And then finally, we have some supplements that you can actually get over the counter. They're called coenzyme Q10 and riboflavin, which are also used in the prevention of CVS.
So a lot of medicine is not an exact science. It's a bit of an art form. So how do you determine which of these medications is going to work best for an individual patient?
Well, that's a very good question. Like I said, it really depends upon the patient profile. And say there's somebody who comes in, and I would try to start the first line agent, that is amitriptyline, because it's inexpensive, it's easily accessible, and it is effective in patients. And however, if they develop side effects, if there's somebody says, oh, I've gained 40 pounds and I can't go down this route, then we go to other medications. And like I said, there's a lot of work, unfortunately, that needs to be done in CVS. There's inadequate funding. We really need to develop newer therapies for cyclic vomiting syndrome. And so I'm hopeful that in the future we'll have better medications.
So you've gone through all the medications. Is there anything that you recommend or the patients can do that doesn't involve medications that can be helpful?
It's very important to treat stress and anxiety and so on. And, I can't emphasize enough about the mind-body connection. And in fact, we did a study and we found that meditation can actually improve outcomes. It improves coping. In patients with cyclic vomiting syndrome, it improved their sleep, it improved quality of life. And so these are also things that I really encourage patients to do in addition to taking a medicine.
Yeah, it's interesting how meditation and other stress-reducing exercises can help people in so many different ways to make their life better and reduce potential illness.
Yeah, absolutely. And I think we really live in a society where there's, so much of sensory bombardment, if you will. And so to kind of quiet the mind down a little bit and really relax and help us manage that stress and, of daily life is very important, particularly in a condition like CVS.
Now, you obviously do not have CVS, but what do you do on a daily or regular basis to meditate or reduce stress?
I practice what is called heartfulness meditation. It's actually heartfulness, like the heart.
Yep.
And at least the days I meditate, I feel very grounded. It helps me stay balanced. And this is something I wanted to share really with the rest of the world and my patients. And I said, why not? And so we did this study, which was very effective. And actually now we're conducting a study. And we designed an app, and we are going to analyze our data pretty soon. And I hope that we'll have an FDA-cleared app for this type of meditation, and with scientific data backing it.
So that was a great overview, and as always, you're very good at summarizing. So summarize how people can prevent CVS.
Yeah. So to really kind of in a nutshell, cyclic vomiting syndrome can present either as mild disease or moderate to severe disease. And we already spoke about how these CVS episodes can be so debilitating for patients. So I think it's very important to really prevent these CVS episodes so that people can carry on with their lives. And so if you have moderate to severe CVS, the recommendation is that we start what is called prophylactic or preventive medications in these patients. We do have a few options. It's very important to learn how to administer these medications, get comfortable with these medications, because there's actually data to show that even gastroenterologists are not comfortable prescribing some of these medications. And I really do hope that people will download our guidelines and use it to treat these patients.
Well, thank you for that great overview and information, and thank you for watching, and stay tuned for our next episode.